you a member of CPM?
Hi, yes, how are
Oh,
you?
good. How are you? What's your
I'm
name?
good. My name's Regina.
Oh, my name's Jessie. I love your dress.
Thank
It's super
you.
cute.
Thank you so much.
And what brought you into the credit union today?
I just had to cash my check.
Oh, okay,
Yeah.
that's great. My name's Jessie, and we're just here working with all of our members today. We want to tell you about some valuable benefits that we have to offer you. So
Okay.
if you just come with me, I just want to talk to you about
Okay.
some things, okay?
I don't really have too much time. Is this gonna take long?
You know what, I understand time can be an issue. It's not gonna take very long at all. Just come with me
Okay.
and we'll get you in and out.
Okay, thank you.
Yeah, you're welcome. All right, so you mentioned that you were cashing in a check. Are you working?
Yes.
Oh, where do you work?
I work at BMW.
Oh, okay, what do you do for them?
I'm the administrative secretary
Oh,
there.
that's great. Are you full-time?
Yeah.
Oh, good,
Yeah.
good. And I'm sure that they offer you some great benefits through them?
Yeah, we have really good health insurance.
Oh,
I'm so
really?
happy about that.
Really?
For me and my family.
Oh, that is awesome to hear. I'm here today to just talk about some exclusive benefits available to you, such as our whole life insurance. Have you ever thought about life insurance? Do you have that through BMW?
Yeah, we have that through the job, so I probably don't need this.
Yeah, I understand. I thought the same thing at one point, and then I unfortunately left my job, and I wasn't able to take that life insurance with me. Yeah, so a lot of the times it is just a term insurance through your employer. So have you thought about what you would do if you left your job?
Ugh. No, well, I mean, I thought I could bring it with me, so apparently, no. I
Yeah,
haven't
a
thought
lot of
about it.
people think that, yeah, unfortunately, like I said, I thought the same thing, and then I lost someone very close to me, and I know it was very hard on my family. Have you ever lost
Gotcha.
anyone close to you?
Yeah, we lost
Yeah.
my grandmother probably about 2 years ago, and it was, it was really hard. I mean, it's emotionally draining, and then it's financially
It is,
draining. She
yeah,
didn't have a
yeah.
big policy. So.
Absolutely, and what was that hardship like on your family? Is it,
I mean, we were
It's hard for a
stressed,
lot.
and, it was really a lot.
yeah,
It was a
I'm
lot of
very
work.
sorry to hear that, yeah. So have you ever thought what you would do in that instance?
I mean,
Tell me how you would feel, if you lost, someone close to you, and how would you be able to afford that?
I mean, honestly, like I said, I never really thought about it because I just, thought that my job would
Yeah.
be able to take care of everything. But now that you're, putting it into perspective for me, I guess I don't really have a plan.
Are you married?
Yes, I am.
Oh, well, that's great. And do you have children?
Yes.
Oh, good. How many?
2.
Oh, that's awesome. What are their names?
Brian and Sasha.
Oh, that's awesome. All right, well, I'm just gonna gather a little bit of information, and I'm gonna tell you what this kind of looks like for you, okay?
Okay.
Yeah, and what's your last name?
Jones.
Okay, and how do you spell your first name?
Regina, Regina.
Okay, just wanted to make sure I got that right. And what's your date of birth?
May 18th,
Okay.
1963.
Okay. And have you smoked 1 or more cigarettes in the last 12 months?
Oh, no.
Oh, good.
Can't do that in my family.
Yeah, absolutely. That's what we like to hear. Well, I'm going to just show you here, like I said, I'm going to show you what this looks like for you.
Okay.
It's a very exclusive benefit for the members, so we get you a really good rate. And it is all age considered, so you want to lock in the lowest rate possible. So that's what I'm kind of here to talk to you
I
about
mean, I'm
today.
definitely willing to listen, but I don't know if I could buy it because I hear, I know life insurance is really expensive and
Yeah.
it's just not something I can really handle.
I do understand that. It seems like everything is so expensive these days. But luckily, like I said, you're a member of CPM, so we are here today to offer you these low rates. So I'm going to show you here now just what that is going to look like for you. We can offer you something that you're comfortable with. So
Okay.
you mentioned again that you were cashing a check. Do you get direct deposit?
Yes, that was just an
Oh.
extra check from my
Oh,
employer,
good.
so I just had to cash
Okay.
that one, but the rest of my checks go direct deposit.
Okay, to the credit union.
Yes.
Okay, that's
Yeah.
awesome. That's so
And
good
with
to
this
hear.
credit union for probably about 15 years now. so
Oh
I'm
my
not going
gosh,
anywhere.
yeah, absolutely. What's an annual salary look like for you?
I just got a raise, I think it's 41,500 now.
Okay, yeah, on the whole life insurance, I recommend 1 to 2 times your salary. You're married, you have children, what would that look like on your spouse? If something were to happen to you and, he has to take care of the kids on his own and he
Yeah.
lost that.
Yeah,
So
no,
I'm gonna give you a couple quotes here.
Okay.
Just something, again, I wanna keep it affordable for you, so if at any time, you just let me know what you're thinking, okay?
Gotcha.
All right, so here we have a face value of $65,000 in coverage. That's to cover things, again, not only your funeral expenses, but, you know, if premature death were to happen, that is going to cover your spouse, you know, in losing your salary. He can take care of the children comfortably. You know, I wanna make sure that your family is taken care of. Something we all hope for is retirement, so,
Yeah,
you know, it does
definitely.
build that cash value as well, you know, within the future, if you need to borrow something, you know, that's definitely there. We wanna protect
Yeah.
your family, your finances, and your future. So this is what this would look like here, about 4871.
Is that, a month or paycheck?
That is
what-
weekly.
Oh, wow, yeah, that one's a little expensive for me.
Yeah, absolutely. What kind of payments do you think you would be comfortable with?
Probably like, how often does this like come out? You guys will take it out once a month?
Actually, at the credit union here, what we do is it's going to follow your paycheck.
Okay.
So if you're paid every week or every 2 weeks, it's gonna come out based on your paycheck. It's really easy for you, you know, you almost won't even notice it's coming out after a while.
I get
Yeah.
paid every 2 weeks, so I guess every 2 weeks I can do something like maybe like $25,
Okay, and again,
maybe 30.
okay, well, let's put you at $30.09 a week. That's gonna give you 40,000 in coverage. Again, what this is gonna do though, you can add on to that at any time. You know, if you're thinking that that's not enough at some point, go home, discuss it with your husband, you know, that's gonna give you, and again, that's coverage for you. But we can also, I can get you a quote on covering your spouse as well. We wanna make sure that those children are covered as well.
Can we just start off with me for now?
Yeah, I do understand that you do wanna start off with just you. Luckily, this is just like an open enrollment period, you know, if something were to change in the future, you know, you can make changes at any time, but we do wanna make sure that you guys are both covered, and you guys will be covered from the moment that you leave here today. So, yeah, and I mean, I'm sure that he would be proud of you, you know, for kind of not only thinking about yourself, but thinking about him as well. I'm not sure what he has through his job, but again, you never know when that is term insurance or.
I think he has something outside of his job.
Oh,
I think he has a policy. I'm not sure. I'll have to talk to him about it, because I know I think he's always talking about Allstate.
Oh.
And it was something that he had from years ago that, you know, even before we
Okay.
got married, so I know
Right.
it's really cheap.
Okay.
So I probably just wanna really think about me right now.
Okay, well, let me get into your information here, and then we can speak a little bit more about that. I'm just gonna
Okay.
gather some basic information, that way we can lock you in at that low rate today,
Okay.
okay? All right, Regina, what is your social security number?
It is 225-111111.
Perfect, and your address?
My address is 15 Happy Court,
Okay.
and that is in Happyville, South Carolina, 25511.
What a great place to live. How can you not be
Thanks.
happy living
Thank
there,
you,
right?
yeah.
All right, and, do you have a cell phone?
Yes, it's 910
Yes.
552-5252.
Perfect. And an email address?
It is Danielle, Danielle, M as in Mary, 1882 @gmail.com.
Perfect. And we gathered those phone numbers and email just so that we can reach out to you in regards to any policy changes. You know, we'll be able to send you forms and everything. Is that okay to do?
Yes.
Okay, perfect. Let me just finish filling that in here. So, are you up to anything fun this weekend with the children?
Probably homework this weekend, because they are, you know what, they may
Yeah.
be grounded.
Oh,
They
no.
haven't been acting too good, so.
Well, Easter's coming, I know, so
Yeah.
they're probably excited about that. Maybe it's
We'll worry
acting up a
about
little
the
bit.
Easter next week. They're gonna get grounded this week.
I hope not, no. And you said, where does your husband work?
My husband?
Yeah.
My husband works in Target.
Oh, okay.
Yeah.
Good, I know you said he had a good job, so I
Yeah.
was just curious more
He's a
about
manager
that.
over the store there.
Oh, good for him, so his salary's probably pretty high.
Somewhat.
Okay, well, yeah, again, you know, you definitely wanna think about, you know, what it would feel like for you, God forbid, something were to happen to him and you were left to work with, you know, just your salary and raising those children. You know, it's just, we just wanna make sure that you guys are covered completely. In the event of anything that's happened, have you lost anybody, you know, really close to you? I know you said earlier, but have you thought about what that would feel like for you?
Not really.
especially raising the children.
Yeah, if something happens to him, no, not really. I didn't really think about it that way.
Yeah, what would you feel like,
I mean, number one, that's my
Overwhelmed.
husband, I'd be devastated, and
Yeah.
that definitely would be overwhelming,
Yeah.
so.
Absolutely. Yeah, well, if you're interested, I would love to pull you a quote. Again, being a member of the credit union, you're gonna get the lowest rate possible. And I can, again, open enrollment period, I can pull you a quote and see what that would look like to cover both of you. We definitely wanna ensure that you're
I'd
both
love
covered.
to see what it would be like for
Yeah,
him.
absolutely. And what's his first name?
His name is Brian.
Oh, great name. Same last name?
Yep.
Okay.
So I'm not sure if I'm gonna do it, I do wanna hear the quote, but I still wanna see what he has at home first.
Absolutely. And his birthday?
His birthday is, February 17th, 1963.
Oh, he's almost a Valentine's baby.
Mhm.
And has he smoked one or more cigarettes in the last 12 months?
No.
Good, good. I am so glad to hear that. Okay, just give me one moment here and we'll get that quote for you. Again, I love your dress. Where did you get it?
Thank you so much, I got it at, Macy's.
Oh my gosh, that's one of my
Had to
favorite
think for a
stores.
second,
Yeah.
Thank
You definitely
you.
look like someone that can, be in with the fashion, so
Oh,
that's so
thank
great.
you. Thank you so
Sometimes
much.
we're hard on ourselves and,
Yeah,
we
no,
don't
so
think-
true.
Yeah, absolutely.
Thank you.
Yeah, no problem. And again, let me get you something that you're comfortable with. So I kind of want to talk about his quote. We can always start a little bit lower on him. And then once you speak with him, you can increase your coverage at any time, okay? So let me just get this in here.
This is him texting me.
Oh my
Now,
gosh.
he's just texting to see if he gets that
Yeah,
policy.
that would be great, absolutely, yeah. We definitely want to make sure.
Okay, I'm just waiting for him to text me back now.
Okay, great.
See what he says.
Okay, and again, recommended coverage, we can cover, again, 25,000 on him is gonna be $18.91 a week. So your total, monthly deduction on that would be $81.94. That's gonna cover you, again, for 40,000, and it's gonna give him $25,000 in coverage. So the 3009 would be on you and the 18, so it's gonna be under $50 a month.
He
Per
just
week.
said that he has 50,000 with Allstate, so he
Yeah.
told me to just go for it on myself, because I still don't have anything besides what's at work.
Okay, yeah, we definitely just wanna make sure that you get covered then.
Yeah.
And get you through the process.
I didn't even know he had that much, I guess that's, and we live in the same house, so.
I definitely understand. All right, Regina, just ask you a few more questions here.
Sure.
I know that you're in a rush, so let me just get you out as soon as I can. Who would you wanna list as beneficiary?
Oh, definitely my husband,
Okay,
that's Brian.
great. All right, he lives in the same household you said, so
Most
that's good.
definitely, yeah.
Sometimes you never know. What's his phone number?
His phone number is 910-555-5555.
Alright, I'm gonna add him on, and you want him to receive 100% of the
Yes.
benefits, okay?
Because he would take care of our kids, so I want to
Okay.
make sure he gets it all.
Absolutely. All right, Mrs. Jones, and I'm going to ask you a few other questions, so I'm gonna go ahead and open this. While I go through them, I want you to kind of read through as well.
Okay.
Okay, and it makes it a little bit easier, so we're gonna be answering these questions here. Have you missed more than 3 consecutive work days during the last 90 days due to heart disorder, cancer, stroke, kidney disorder, lung order, or diabetes?
No.
Thank goodness. Have you ever been diagnosed, AIDS, HIV, anything?
No.
That's awesome. In the last 5 years, have you used heroin, cocaine, LSD, anything that was not prescribed by a physician?
No.
Okay. And do you have any existing life insurance policies, other than the one with your?
Just the one with work,
Okay,
yeah, I don't have anything
perfect.
besides that.
Okay, good. And will the insurance, have you been hospitalized in the last 90 days? Hospitalization, have you stayed overnight in the hospital for any
No,
reason?
no,
Okay.
I was in the emergency room for a stomach ache like the other week, but not overnight or anything.
Okay, good, awesome, that means that you are qualified.
Okay, that's
So we can get
great.
you covered
That's
today. And then just a few more questions.
So just one more thing before we do this,
Yeah.
can I come back, because I can't really, I don't have the money today, I have to pay the bills with
Right.
a check I just cashed. So I'm probably not gonna have it till next paycheck, probably in the next 2
That's
weeks.
fine. The great thing with our credit union here, because I can completely relate to you with that.
Yeah.
You're not expecting to buy something, when you come in today. We take it out in 1 to 2 pay periods, so you're not gonna pay me
Ah.
anything today, but you're going to be covered when you leave here today.
So it's gonna automatically just come out my
Yeah.
next paycheck? Oh, okay, great.
Yeah.
Yeah, okay, yes, do it then.
It'll be perfect. Yeah, I hope that works.
But I'm
for
still
you.
covered today?
You're covered today.
Nice.
Yeah,
Okay.
absolutely. So you can go home and tell your husband,
Yeah, definitely.
Yeah,
All right, that's
absolutely.
great.
All right, just a few more questions again. I'm gonna get you out of here fast as possible. Are you covered by Medicaid?
No,
Do you have enforced or pending approval, any long-term care insurance, anything like that?
no.
Okay, and do you, other than for normal childbirth, in the last 24 months, have you been an inpatient or a hospital? You already answered no, so we're gonna put no there. And do you require assistance or supervision, daily living? Do you have trouble performing any daily living
No.
activities? Okay, and have you ever been diagnosed, treated or tested positive for brain, nervous system disorders, muscular dystrophy, rheumatoid arthritis, anything like that?
Mm-mm.
Okay, perfect. It's good to hear, pretty healthy.
Yeah, no, definitely, thank God.
Yeah, it's hard to keep up with.
Those are some
sometimes.
tough things you were reading.
Yeah, I
I
know.
can't imagine someone going through that.
Yeah, there's some pretty, unfortunate situations that
Yeah.
can happen, and you wanna make sure that you're covered for anything like that, cause you never expect it to happen to
Absolutely,
you,
yeah,
so.
no, I
yeah.
agree.
All right.
This is gonna be much longer because I have to get ready to go.
Yeah, I totally understand, and nope, it's not gonna take much longer at all, I'm just gonna
Okay.
finish up here for you.
Okay.
And I also wanna just let you know, as I'm going through the policy here, you do have children. We have an awesome product that it is a children's term rider. Goes along with your life insurance policy for $1.20 extra per premium. It's gonna cover your children, God forbid, if one of them were to pass away. It's gonna cover each child for up to $10,000.
So $1.20 for each of them?
No, it's $1.20, just for up to 10 children, so, if you have children in the future, they're covered under this as well, even if you did put them on today.
For $1.20, add them on.
Okay, great,
I
yeah.
thought it would be a little more expensive. for
Yeah,
kids, but I guess
everybody
not.
always does, and nope, we're gonna get them here for you today as well
So
with
you could just add
that.
them right on, yeah.
Yeah, okay, great. Oh, computers, technology.
Yes, trust me, I know, I deal with mine every day at
Yeah,
work.
sometimes they are a pain, but we'll get through it. All right. So sorry for any delay here.
My husband just told me that he's gonna get the kids off the bus, so
Oh,
I have
good.
a couple more minutes.
Okay, great, good. Finish up here really fast.
Now, I've seen something that says cash value, so like what does that mean?
Cash value, that is gonna continue, to build over the life of your policy, so as long as you continue to build your, your premium, pay your premiums, excuse me, that cash value is gonna continue to build over the life of your policy. In the event, again, we all hope for that retirement, something happens unexpectedly, car repairs, anything like that, you're able to borrow off of that.
Oh,
Yeah.
okay.
So again, it's good to get it, as soon as possible. If you get it today, that's the longer it's gonna have to build up that cash value for you.
Okay, great.
Yeah, absolutely.
Do you need to type in my children's names or anything?
No, I'll go over that with you in a minute here. I'm just stuck on this one page that I've never seen before, actually, so we're just gonna try and get past that.
I can type in my children's names if you need me to.
You know what, why don't you jot them down for me, that would be a little bit easier.
Okay.
So that looks good.
My son's Brian, his name is Brian. You need their birthdays too?
Yes, please. Yeah, any information that you can provide is gonna help, so I'm at that page right now, and we're gonna go over this for you. Great
So-
names.
Okay, it's Brian Jones Jr., and his
Okay.
date of birth
Mhm.
is May 28th, 2008.
I have a niece, born in the same year.
Oh, nice.
Yeah, absolutely.
Nice.
All right, and they live in the same household with you?
Yeah,
Okay.
and then my daughter's name, here you go, Sasa Jones. And then her date of birth is October 17th, 2010.
All right, great. And she lives in the same household?
Mm-hmm. Both of my kids do.
Okay. That's wonderful. Let me get you, it's gonna be $31.29. It only went up again by that $1.20. You're
Okay.
covered for 40,000 and your children are covered, each of them, for 10,000, okay?
Okay.
All right. Just get this sample policy going, or temporary policy going for you here.
Okay.
Okay, and then I'll explain everything as soon as we're done.
Okay.
And we are almost there. Do you have any plans for Easter? You know, what do you do with the family?
Yeah, we go to church and then we have a big Easter dinner,
Yeah.
so we invite everybody over, so I'm preparing for that.
That is so
Um,
fun. Yeah, that's always a good time
Yeah,
for the children.
I get the kids Easter baskets and
Oh,
we do
yeah.
a little Easter
Yeah,
egg, so
too.
it's like a big thing with my
Yeah,
family.
absolutely.
Yeah.
In the event of, you know, something happens, lapse or termination of the policy, do you wanna elect anybody to receive information on that, or would you just prefer it goes to you?
Yeah, just
For right
me.
now? Okay,
Yeah.
and again, we can change that in the future.
Okay.
Okay, all right, and we're gonna just go ahead and sign some forms here. And I am going to email you everything that you need, okay, your policy, any disclosures and stuff like that, they're gonna come directly to your email for you,
Okay.
okay?
Sounds good.
All right, Regina, if you could just go ahead. I'm gonna have you
Yeah.
sign right here for me, okay? Again, this is just, you went over the consent with me, you know, it's okay to reach out to you by email, cell phone, any
Okay.
changes, anything like that, okay?
Okay.
And then I'm going to sign my portion here. Okay, and then this is gonna go over your policy, this is what it's gonna look like for you, okay? $40,000 in coverage, $30.09 a week on you, 10,000 in coverage is the $1.20.
So it's 10,000 on each of the kids?
Each of your children, yeah.
Okay,
So
that's
for a
great.
total, it's gonna be the $31.29, okay? It's gonna come out bi-weekly again. This just comes out of your paycheck. We follow your pay schedule, so the $31.29 is going to come out every week. I don't have a calculator on me here today. And then you're gonna start seeing that in 1 to 2 pay periods. What the credit union is actually gonna do for you is set up an insurance account. So this is just gonna be a separate account. Again, this doesn't affect you, it's nothing you need to do, we take care of that completely for you, okay?
Okay.
So you're just gonna watch for it to come out of your paychecks every 2 weeks.
Okay.
This number here is our customer service number. If you need to make changes or, you know, have any questions, feel free to call that number, but I'm also giving you a business card today because I want you to reach out to me if you have questions. I'm your
Okay.
representative, and I just wanna make sure that, you know, you're comfortable with everything that we did here today.
Definitely.
Okay, Ms. Jones?
All right,
All
thank you
right,
so,
well, thank
so
you.
much.
Thanks for
I
coming in.
so appreciate all of your
Yeah,
help today.
absolutely.
Thank